Miscarriage, especially in the first trimester, does not automatically mean you need to go to the emergency room. But ultimately, it should not be more bleeding than what I just described. But a miscarriage you're going through because of loss. Most of the time, once you take the medication, you're going to experience bleeding and cramping within the first 24 hours. And so one of the risks with medical management is actually that you partially pass the pregnancy. That injury to the uterus that's a potential risk of the surgery can potentially impact future pregnancies. Unfortunately, miscarriage rates are about 1 in 4. That's 25% of pregnancies. And if you're experiencing a miscarriage now, or if you've ever had a miscarriage in your past, I'm so sorry for your loss. And let me tell you what your provider probably already told you. You did nothing wrong. You did not cause this. Miscarriages are almost always, especially when they're less than 8 weeks, a mismatch between a sperm and an egg. And there's nothing you could have done to prevent it. And there's nothing saying that you can't have a very healthy and normal pregnancy next time. In fact, miscarriages, at least one miscarriage, are very common. And even having 2 miscarriages, that still means that you could have a normal pregnancy next time. Those are both very normal based on miscarriage rates. But if you've been newly diagnosed with miscarriage and you were too shocked when your provider went through all of your options to really listen and pay attention to what your options were, then this video is for you. My name is Megan Galloway. I'm a certified nurse midwife, and I have walked through many, many miscarriages with women. And I encourage you to listen to these options, think them through, and choose what's right for you. And if you like this video and you want to learn more about pregnancy and women's health, make sure to like it and subscribe to my channel. Now, in this video, I want to differentiate between miscarriage and missed miscarriage, because missed miscarriage is what we need to manage. And if you want to learn more about what a missed miscarriage is, I have a video on that. It's the second in a series on early first trimester ultrasound findings. So the first thing your provider probably talked about was what's normal. So maybe you went in, you had your first ultrasound, and you found that there was a baby in there and there was no heartbeat. And your provider definitively diagnosed a miscarriage. And they gave you the option of waiting to see if your body decided to get rid of the pregnancy on its own. And that's what we call a spontaneous miscarriage, when the body decides to get rid of everything on its own. But a missed miscarriage can turn into a spontaneous miscarriage if you wait a little bit. Usually within 2 to 4 weeks, the body decides that it's done with the pregnancy and will begin the process of that spontaneous miscarriage. But there are times when that doesn't happen. But if you do choose expectant management and you wait for the spontaneous miscarriage and it happens at home, I want to talk about a few things that you need to pay attention to. So the first thing is that miscarriage, especially in the first trimester, does not automatically mean you need to go to the emergency room. However, there are reasons you should go to the emergency room, and the main reasons are significant bleeding and an inability to deal with the pain. So significant bleeding, what am I talking about? I mean, you can bleed quite a bit during a miscarriage. And in the heaviest portion of a miscarriage, what I like to tell my patients is that you might soak through 2 big overnight pads every hour for the first 2 hours. And then after that, it might be up to 1 overnight pad an hour for the next 2 hours. So you might have about 4 hours of pretty heavy bleeding. You can pass some, golf ball sized clots during that. You might notice that there's some tissue that you pass during that. But ultimately, it should not be more bleeding than what I just described. And if it is more bleeding than that, then you need to go to the emergency room because they might need to help control your bleeding. Pain is the other reason you might end up there, because miscarriages are painful. If you start cramping, which you almost certainly will during your miscarriage, it can almost feel as bad as labor to some women. And especially with the emotional part of it, the loss side of it, you don't get to have a healthy baby at the end. And I think that's what helps a lot of women cope with labor pain. But a miscarriage you're going through because of loss. And so if you need help with the pain, then you should go to the emergency room as well. Now, say you don't want to wait. Say your provider diagnoses the miscarriage and you are emotionally not feeling well enough to just wait until it happens, or you wait for a couple of weeks and nothing does happen, so you want to move on to the next step. So that next step is what we call medical management, and basically it just means we're giving you medication to help expel the pregnancy. The primary medication we use is called misoprostol. In some places they also add mifepristone, but we'll just mostly go over misoprostol here because that's the standard. So that is a tablet, and they usually give you about 4 tablets, and you're going to either place them vaginally or orally depending on what your provider recommends. Most of the time, once you take the medication, you're going to experience bleeding and cramping within the first 24 hours. There is a chance, however, that it won't work within the first 24 hours, and then typically you can take a second dose at that 24-hour mark. Now, medical management has about an 80% success rate overall, and that success rate is for a complete miscarriage. So some people do start having bleeding and cramping, but they don't feel like they really passed much, and some people don't have bleeding and cramping at all. And so one of the risks with medical management is actually that you partially pass the pregnancy, but you don't pass the entire thing. And that could end up needing surgical management, which we'll go over next. But a real quick note about misoprostol before we get into that surgical management. The unfortunate part about that medication is that it has some side effects, and especially when given in big doses like what you need to elicit a miscarriage, it is not great. You oftentimes feel nauseous, you might have vomiting, you might have diarrhea, you might have low-grade fever. So that's something I want you to take into consideration if you're choosing this option, because not only will you likely have to deal with the pain and the bleeding, but you also might have to deal with the side effects of the medication. And this is why some people go straight into surgical management. So surgical management is what we call a D&C, dilation and curettage. It's basically where you have a small surgical procedure. You are put under anesthesia. The doctor will place something inside your uterus to essentially suck the contents of your uterus out. They may use this little metal tool that also kind of gently scrapes the inside of the uterus to make sure they've gotten everything. And then you come out of the procedure and the miscarriage is complete. And the surgical management is great because it's almost 100% success rate. So for people who don't want to wait, or for people who did not have success with the other 2 options, surgical management is a great option. However, it does come with risks. So anytime you have any sort of surgical procedure, there's always risks. There's risk with the anesthesia, there's risk of injury to your uterus, there's risk of bleeding afterwards, there's risk of infection. And then another thing to consider when you're undergoing D&C is that injury to the uterus that's a potential risk of the surgery can potentially impact future pregnancies. If there's an injury to the uterus, it can make miscarriages more likely, and it can potentially cause some complications for future pregnancies. So while your surgeon is going to be very, very careful in performing this procedure, there's always risks. And if you're thinking of jumping straight to D&C, I want to make sure that you understand the risks before you choose that option. If you're currently experiencing pregnancy loss, or if you have in the past, once again, let me just say I am so sorry for your loss. If you have questions or you want to tell your story, please make sure to comment below. But remember, I'm not here to give you medical advice. I hope that you've gained some insight from this video, but if you want to talk more about your options, make sure to talk to your healthcare provider. If you want to learn more about that missed miscarriage, make sure to check out this video here that goes over missed miscarriage and some of the other weird early ultrasound findings you might have at your first trimester ultrasound. And remember, you did not cause your loss. You could not have prevented your loss. And my hope for you is that you have a normal and healthy pregnancy next time. Thanks for listening, and stay healthy, everybody.